October is Breast Cancer Awareness Month. In 2015, about 25,000 Canadian women were diagnosed with breast cancer. That is about 68 women each day. Yeah, digest that for a moment. But only 1 in 10 women will opt for breast reconstruction surgery after having a mastectomy, a procedure that is medically covered in this country. The Canadian Breast Cancer Foundation is hosting a Breast Reconstruction Awareness Day, or BRA Day as it's known. This event was started 6 years ago, and it continues to promote education and awareness for women considering the procedure. Dr. Mitchell Brown is the founder of BRA Day. He joins me now alongside Natalie Witkin, a breast cancer survivor. Thank you both so much for being here today. Let's start about how this idea was born. What can you tell us about that?
Well, you know, having been involved in breast reconstruction for a number of years in my practice, we started to see quite a number of patients who had come in, had mastectomies or had been treated for breast cancer previously, and then showed up to discuss reconstruction or reconstructive options. And it was a natural question to ask, why are you here now? What took 6, 7, 8 years for you to come and investigate the options for reconstruction? And constantly the answers were, I didn't know that breast reconstruction existed. It was never offered to me. I've been living for years using a prosthesis. It's been cumbersome.
So it was never part of the conversation with the doctor to say this is an option?
It's a huge challenge. It's a problem. It was at that time, which was part of the reason to start an awareness initiative like BRA Day. It continues to be, but I think a lot less so today than it was 6 years ago.
Yeah, and you know, the numbers, only 9% of Canadian women opt for breast reconstruction surgery after having a mastectomy. Why did you opt to do it?
I was 37 at the time that I was diagnosed with breast cancer, and although I had a fairly small tumor, which may have only required a lumpectomy, I also carried the BRCA gene mutation, which put me at higher risk just to have another cancer sort of in the future, another breast cancer. So to reduce my risk and to remove the cancer, it was recommended to have a bilateral mastectomy. And I wanted to have reconstruction at the same time if possible. I was young. I wanted to restore my body back to sort of as close as possible and feel like I could then, you know, after surgery and treatment, go on with my life.
And for you, that was sort of a natural question, and you thought, you know, I want to do this right away. What questions did you have around the surgery that you were asking at that time?
Well, there are choices about the ways that you can reconstruct a breast. You can reconstruct a breast using an implant. You can use your own tissue from your stomach or other parts of your body. So I had questions around what would be the best way to reconstruct for me. And then on a more personal side, it was important for me to sort of know what would my appearance look like? Where would my scars be? What would my recovery be like? What's intimacy like after having reconstruction? Sort of, and that's those questions are really often best answered by somebody else who's gone through it.
Yeah, exactly. And that's part of BRA Day too. You have people there that could show these women what it would look like, right?
Yeah, BRA Day's really, I think, really migrated into quite an exceptional event. There's 3 main components. We'll have women come and have an opportunity to be educated. So there tends to be an educational component, often lectures or speakers that will talk about breast reconstruction to inform and educate. There are exhibitors that are there, and the exhibitors are there to demonstrate or show some of the materials or supplies or products that are used in breast reconstruction, such as different types of implants or internal slings or meshes that we use to help to reconstruct a breast. And I think one of the most unique features is the show and tell lounge. Natalie was very much involved in getting that off the ground, which is a very private, unique area where women can go into a private room with other women who have undergone breast reconstruction. And these women will actually show what their results look like, talk about their experience, and I mean, how best to be able to get informed about what things may provide, what things may look like, than to be able to talk to someone who's
see it,
yeah,
right? And to talk to someone,
and in some ways to even be able to touch it. You know, women will talk about what will my breast feel like if it's been reconstructed with tissue. Or
because what are the biggest misconceptions? Are those some of the questions, thinking that, you know, it's not going to look the same, or what other questions?
Well, some of the simplest things are, you know, it's one thing to reconstruct a breast, but how will my breast feel? Will I have sensation in my breast? What will that mean to me? Will it be cold? Will it feel warm? Some of the things that are practical that as surgeons we try to pay attention to, but sometimes don't have that same insight that a woman who has undergone this might be able to communicate to other patients.
And do you think you made the right choice by going through?
I absolutely made the right choice. You know, it allowed me to restore my body as close as it could be before, and be able to put my sort of breast cancer experience behind me. The tagline for Broad Day is closing the loop on breast cancer, and I feel that it really actually describes the process of reconstruction. It kind of allows you to sort of close the loop on the experience and move forward.
And what an experience for these women to be able to go and to talk to those cancer survivors. And also, I really love the show and tell idea as well. So there's a really tactile feel to this event. Thank you both so much for being here, Dr. Brown.